Menopause is a major chapter in women's health, yet it remains widely misunderstood and often overlooked. On this episode of the Aging Well podcast, we are joined by Dr. Cecily Havert, a board-certified family medicine physician with a deep passion for women's health and preventative care. Not only is Dr. Havert guiding her patients through the menopause journey, but she is also experiencing it herself, giving her a unique perspective that blends medical expertise with personal insight. Dr. Havert is dedicated to breaking the stigma around menopause and empowering women with the knowledge they need to navigate this transformative phase with confidence. We'll discuss the confusion surrounding hormone replacement therapy stemming from the 2002 Women's Health Initiative study, how recent research sheds new light on its benefits and risks, and the evolving cultural narratives around aging. We'll also share insights on the challenges faced by women of color during menopause and how Gen X is redefining conversations about women's health. Dr. Havert's practical and empowering approach makes this a must-listen episode for anyone looking to embrace strength, health, and informed choices in midlife and beyond to age well. All right, well, Dr. Havert, welcome to the Aging Well podcast. Let's begin by having you tell us a little bit about yourself and what inspired your journey to focus on menopause and women's health in your practice.
Well, thank you so much for having me. I'm really excited to have the opportunity to talk to you about some of these topics. So, yeah, I am a family medicine doctor. I have been in practice for over 20 years now, and I'm in a private practice in Arlington, Virginia. I practice what's called concierge medicine. I don't know if you or your listeners are familiar with that. But basically, it is a type of it's a platform for practicing medicine where we get to spend more time with our patients. So I have a smaller panel of patients, so I don't have to see as many patients during the day, and so that's giving me the opportunity to really be able to deep dive into some of the more pressing issues of my patients who may not necessarily have opportunities that they were in a regular type of practice to uh to be able to discuss this with their doctors or their healthcare providers. So yeah, so I'm trained as a family medicine doctor. I do have a special interest in women's health, and as I've aged myself, believe it or not, I just turned 50 last year. I really started sort of laser focusing a little bit more on menopause, mostly because I was experiencing the same things that a lot of my patients were. And, I spent the last 20 years listening to women, talk about how challenging this time is, how they feel like an alien's taking over their body. And listening to them, I would empathize and validate their feelings, but I really didn't understand what they were going through until I started going through it myself. And I said, you know what? I need to find a more powerful, uh, proactive way to approach this change.
And here you are talking to two men about menopause.
Well, you guys are going to learn a lot.
Yes.
I'm excited
But
to learn.
yeah, but honestly, not a lot of women understand either.
Right.
So you know what, you're in really good company, and I really think that menopause is having a moment. I don't know, in terms of looking at a lot of the news features. I mean, it's menopause is being mentioned more in the media these days, and I think it's good to bring just casting a more of a spotlight on this issue and bringing awareness around it. So I'm happy. And being a Gen Xer, I'm gonna credit my fellow Gen X women for rising up and saying this is something that we need people to know more about.
Yeah, I'm a tail end boomer. So,
Oh, okay. All right. Well,
I'm an
whatever
elder
that's worth, right?
millennial. Just
And you're just, oh my gosh, I think we've got it covered. So
yeah.
all different
yeah,
perspectives, approaches to
that's
life,
right.
that's fine, and it's all just about what our generation, has experienced and our parents. And then, if we have kids, our kids, and just how that forms us as a person. So, yeah.
Yeah. Well, many misconceptions about menopause persist. What do you find are the biggest myths that need to be debunked?
Myths that need to be debunked. I think that looking at menopause as an end of something, I mean, I guess it is. If you look physiologically, sure, menopausal women can't have children anymore. So I guess it is sort of the end of our reproductive years. But a lot of times, I feel that when women are seen as not being a reproductive age or not being able to have children, they're sort of seen as less and devalued somewhat. And, and I'd like to, use this opportunity or even just allow women to see this as a positive change into something that could actually make them better. It's moving into something better. It's moving into something different. It doesn't necessarily have to be the end of something. We can grieve aspects of changes in our lives, but I think we also have to have the mindset that this is an opportunity to become better and healthier. So I'd like to see menopause as in through that lens rather than an end of.
So it's the end of one thing, but the beginning of something else.
Correct, correct. In the beginning of something else that has value and is important.
And so, can you explain some of the confusion around I believe it's the 2002 Women's Health Initiative study on hormone replacement therapy, and maybe
Yeah.
some of the newer research challenges the newer research that challenges those findings?
Yeah, there's been a big pendulum shift. It's really interesting when the Women's Health Initiative came out, that was 2002. I was an intern in family medicine. So I was just at the very, very start of my medical training. And so it's really interesting because prior to that, I mean, hormone replacement, estrogen therapy, after estrogen, progesterone therapy, after menopause was something that was very commonplace. And the Women's Health Initiative came out, and basically, I guess the bottom line was that, or the way that the medical community and basically just our society accepted it was that estrogen is dangerous. These hormones are dangerous after menopause, and we should not be using it. So we suddenly saw this massive decline in use. And, women who had been on hormones that have been controlling their menopausal symptoms, their vasomotor symptoms were taken off, and it was a big, big shift. And now we're starting to realize that, and, looking deeper at the studies, who was studied in this, in this initiative, we're finding that a lot of the studies were on women who were older. The majority or a good number of them were, not necessarily very healthy. Many of them were obese. Many of them already had cardiovascular disease. And so we were seeing a lot of bad outcomes in women who were older, who were on estrogen. But women who are younger, in their 50s or just perimenopausal, starting to go through the transition, they weren't included a whole lot. And we're actually finding that newer studies show that this age, younger women actually do very well on hormone replacement therapy. Quality of life improves. The risks that cardiovascular risks, the risk for breast cancer don't seem to be, what they were predicting in the Women's Health Initiative. So now we're starting to, rethink and reframe, maybe hormones aren't evil. Maybe it's something that can help us. Maybe it's something, not only help our physical health, but also help our mental health. And so we're just, starting to explore that a little bit more, which I think is very healthy. And obviously, hormones aren't for everybody, and it's a decision that you have to make between, your healthcare provider and the patient. But it's an option that should be considered for many.
I just recently interviewed Dr. Julian Gershon, who is kind of a regenerative aging medicine
Hmm.
doctor, and he talks a lot about optimal hormone levels. And he was pretty adamant about how a lot of that earlier research that presented the dangers of estrogen were looking at synthetic estrogen, and that
Correct.
it's a very
Yeah.
different story if we start looking at natural estrogen replacement therapy.
Yeah,
Would
no,
you
I
agree with that?
agree. Oh, absolutely. Yeah. No, bioidentical is sort of how we refer to them.
Hmm.
The bioidentical hormones. And also I tend to prescribe estrogen a lot transdermally. So that just means it's a patch that you place on the skin. And so the hormones are taken in through the skin. And what that does is it doesn't when you take a pill, it has to go through your stomach. It has to be sort of processed through the liver. It's called the first pass effect in the liver. And that can increase risk for clotting. So we see, blood clots are a risk for women who take estrogen or And we're finding that transdermal tends to be healthier. So we're looking at, bioidentical hormones, different ways to deliver the hormones. So yeah, there's a lot. We've come a long way in making this safer and more effective.
I feel like with your practice of having a little bit more time with your patients, you're
Yeah.
developing that intimacy relationship, so you're able to check on them a little bit more in detail versus someone that just shows up to a clinic and they're like, "Okay, do this. All right, bye. Gotta go to the next one." So I feel like you having that intimate relationship and being able to monitor them, you're probably seeing great results. And I bet your patients really appreciate that as well.
So, I mean, it gives us an opportunity to develop a very collaborative relationship,
I bet.
that's built on respect. Just having more time, I feel, just being able to offer that space for my patients because when you come in and see the doctor, I mean, it's necessarily the most comfortable thing. You're talking about scary symptoms that you're having, things that you might feel embarrassed about. So there's this really, really heightened vulnerability that you walk in with. And if you're working with somebody who gives you space to feel safe when, with these, I think that that's important. So, yeah, so I'm able to really, kind of deep dive with patients and explore not only physical symptoms, but also the emotional symptoms that come along with that and helping them sort of recognize the interplay between the mind and the body and how mental health definitely affects our physical health too, which is something that's
Yeah.
significant in menopause, honestly, because
Totally.
yeah, I mean, the massive drop in estrogen that happens at this stage. I mean, it is like you're going from, normal amounts to, I mean, I mean, it is plummeting. And the effect that that has on serotonin in the brain is
Mhm.
significant. And so, and you hear women talking about, just having more mood lability, just feeling more irritable, poorer sleep. I mean, it's real. There are actual physical things that are happening in the body that are causing this.
Well, what should women know when considering hormone replacement therapy? Who's a good candidate and who might need an alternative approach?
Well, yeah, I mean, a lot, it's, that's a great question. And I think it's very individualized, right? I think what's different now is that it's part of the conversation, whereas before it was sort of something we just didn't really want to talk about. And maybe the patients will bring it up and it's like, oh boy, here we go. We have to talk about hormones. But now it's sort of like, hey, let's talk about it. So who's a good candidate? I mean, I usually um as women who are perimenopausal, who are starting to have symptoms associated with menopause. And these can be, typically the vasomotor symptoms, it's the hot flashes. And this can impact sleep, so poor sleep, the mood situation. So basically, having symptoms associated with menopause. Let's think about hormones. Maybe this is something that's an option. It's not the only option, I also am a big proponent of exercise, especially strength training, and I think that that's really, really helpful to combat some of the physical changes that are happening during menopause. But yeah, so younger women, younger meaning women who are just going through the menopausal change, which is late 40s, early 50s. I think that's a perfect group to be discussing these hormones, and people that who have uncontrolled hypertension, known cardiovascular disease, a clotting disorder. I mean, these are women that we would, have to think much more carefully if this is an appropriate option and maybe think about other options. But yeah, but it's definitely a very individualized consideration.
Is it something that kind of warrants consideration earlier rather than later, like to start tracking women's estrogen levels? And as you start to maybe see declining within the normal ranges, that maybe we start looking at, hey, we want to optimize your estrogen so that we're getting better overall physiological performance.
Well, what's interesting, a lot of there's misconceptions, at least in my practice. I practice through training in allopathic traditional medicine. And so we don't actually check estrogen levels, right? So we don't track estrogen levels. And so a lot of it's just based on symptoms, right? I mean, and so especially during perimenopause, because those estrogen levels are going up and down. I mean, you're still kind of cycling. So you're really not getting great, accurate levels that you can actually take. It's like, oh, your level is this. Let's do this. So we don't actually use that. It's much more. what's going on in your body. What kind of symptoms are you having? After menopause, once a woman hasn't had her period for over a year, we consider a woman to be in menopause. If we check estrogen levels, they'll probably be pretty low, right? When we add that, if we choose to use hormone replacement therapy or estrogen replacement therapy at that point, we don't monitor estrogen to know whether or not it's working. We say, how do you feel? Do you feel better? So it's subjective, interestingly enough.
Yeah, and I guess it's a
What
little bit different. Like with men, I mean, there's that
Yeah.
steady decline of testosterone, and testosterone levels should be relatively consistent from day to day. But women have this nasty monthly cycle, and I'm probably shouldn't say nasty from that way. I just mean it from the
It's a
standpoint.
beautiful change
Yes,
of
it's
hormones.
yeah, it's
But no, it produces some pretty nasty symptoms. It can. It can.
yeah,
And, it is that drop. It's interesting you mentioned testosterone. I'll say something about that in a minute. But yeah, but it's that drop in estrogen that really causes difficult symptoms. So when you're talking about, a woman who is cycling, she's reproductive age, she's ovulating, you hear about PMS, right? You hear about, a few days before. I mean, what's happening physiologically and on a molecular level, I mean, that estrogen level is dropping. Okay. So that's kind of what also happens during menopause, but that's the irritability and the serotonin levels are dropping. I mean, it's not fun. So, I mean, so yeah, as what, every month that can be happening. And it's so interesting you mentioned testosterone because I think that people forget that women also have testosterone. And actually, we have more testosterone in our body than estrogen, believe it or not. It is a extremely important hormone for us. And our testosterone levels also drop during menopause. And that we have symptoms associated with that. So the loss of lean body mass is something that happens to both men and women. Poor sleep, depression. I mean, all of yeah. So actually, testing. So I mentioned we don't necessarily test estrogen levels in women. We do test sometimes. Some doctors test testosterone levels, and replacing women with testosterone is something that should be considered. Actually,
yeah. It's something. I mean, even men's doctors don't necessarily test testosterone unless you really request it, and for women,
Mhm.
it's even less so.
Oh, it's
And
virtually never.
yeah.
Yeah,
And it
yeah.
is something that, really women should consider is,
Mhm.
when you're looking at hormone replacement therapy, it's not just estrogen.
It's not
It's,
just estrogen, you got to consider the progesterone piece too. And you kind of just work little by little. It's not like, oh, you're menopausal. Here, we'll just throw all these hormones at you. I mean, it's very. Let's first of all, what are your symptoms? What are ways that we could do this? What are your options? But then, I won't necessarily start a woman on estrogen, progesterone, and testosterone all at once. There is sort of this fine tuning process, and that's actually one reason I really love working in the concierge medicine world, just because I really can devote time and energy to my patients. I can, so it's yeah, and it's fulfilling for me. I mean, I'm sure I obviously patients, seek out this type of relationship with their doctor because it's something they're looking for, but people forget that it's very, very fulfilling for the doctor too. I mean, I left traditional practices because I was burnt out. I
right?
didn't feel like I was doing a good job. And so
Hmm.
this is, there's a lot of mutual benefits associated with this type of practice. So yeah, I'm really, really happy to be doing it.
and so
One
back
of
to
the
strength.
go
Oh, go
ahead.
ahead. What?
Yeah. Back to strength. You've
Yeah.
mentioned in the past the idea that strong is the new skinny. I like that
Yeah, it's
phrase.
strong as the new thin, and I love that phrase because for lots of reasons. Partly just because of I mean, there are natural physiological body changes happening in women who are going through menopause, right? I mean, like we mentioned, the lean body mass, muscle mass goes down, fat mass goes up. I mean, that's something that happens. Women tend to gain about 10 to 15 pounds. And, it's sort of this, I can't tell you how many times I've had women come to my office like, oh my gosh, I haven't changed anything. And I'm just gaining this weight and everything's right in the middle. And so that truly is something that happens. And, sort of accepting sort of that our body's going to change during menopause. How we looked at 20 is not how we're supposed to look at 50. Okay. So our bodies are not going to look the same. And so this idea that we have to be thin forever is troubling from a mental health standpoint. That's probably another podcast. But what I love is that actually the benefits of weight training, resistance training, and for women who are going through menopause are spectacular. I mean, so our bodies may not look how they were when they're 20, but I'm going to say they're going to look a lot better. I mean, just building muscle mass, being strong, that helps our bones because osteoporosis is something that affects women at this age with the dropping estrogen. Also as women age, falling, I mean, and men, just falling and breaking bones is an issue. So learning balance and everything. So I love this, and it's empowering, right? It's so you feel like you can do something. I mean, just exercise is also so good for our mental health. So there's so many benefits to it. So that's definitely part of my prescription for women who are struggling with menopause. It's all right, let's talk about exercise. Let's talk about lifting heavy things and getting tired while you're doing it. That's how I describe weight training. It's not like you have to become a bodybuilder, but you do have to lift heavy things.
I like hearing that. I always hated when I was training women that were kind of perimenopausal, menopausal age. I don't
Mhm.
want to lift heavy weights because I don't want big, bulky
Um,
muscles. And
yeah.
I finally told my student, I had a student who asked me, how do you address somebody who says to you, I don't want to lift heavy weights because I don't want big, bulky muscles? And I was just in one of those weird moods. And I was just like, you know what? Tell them they're not willing to put the work in. Because really, that's the truth. I mean, even for men, if we want to put on big, bulky muscles, you got to do a tremendous amount of work, or you have to be just so gifted genetically that makes it easier. And most women
Yeah.
aren't gifted genetically like that. And if they are, and they don't want to get big, bulky muscles, it's great for them. They don't have to lift as hard. They can spend less
Yeah.
time in the gym
Yeah.
to maintain that
Yeah.
muscle mass.
Exactly. And it's, healthy at any size is sort of
Mhm.
what I tell women too. And so much of this, that bulkiness, I think kind of stems back to I want to look wispy, I want to look thin. And so some of this is just sort of like the image that women have of what beautiful actually is. Right. And
Yeah.
so part of it has to be changing what society perceives as beautiful. But a lot of it is just the internal work of what we consider beautiful in ourselves and just sort of learning to love our bodies where they are. And so, yeah, I mean, whatever it is, and you don't necessarily have to have big, bulky muscles or anything, but, just this look, being strong, healthy, good posture, all of that is just so important. And I think it also just improves body image too
Hmm.
when we exercise and when we feel strong, right? I mean, it's not like we have to lift, I don't know, bench press 200 pounds, whatever, but it's just, and little, uh, what I work out with a trainer and she's great. And, every time I kind of like hit a new PR for a week or something, it's just kind of a fun thing to celebrate. So yeah, yeah. So yeah, it's a lot of fun.
So, what are the best lifestyle habits women can adopt in their 40s and 50s and beyond to maintain strength and overall health?
Yeah, there's lots of different ways to approach moving your body, right? And so a lot of it has to also sort of where is somebody coming from? Where are you starting from? So it's just, and some people have chronic medical conditions, other issues, and so maybe they can't do what everybody else can do. I just say, just do something. Wherever you start is perfect. But whether it's just make if you're just getting up and walking every day is something that that is where you need to start, then that's fine. That being said, I mean that when I'm prescribing, so people who are able, capable, for the most part, don't have chronic medical conditions or disabling musculoskeletal issues, I like to prescribe both a sort of a resistance or a weight training type of regimen, but also kind of interval training, I think is also important too. I think it works two aspects of our health. With the interval training, there's the cardiovascular, the endurance piece of it, which I think is also really, really good for cardiovascular health. I mean, that's the other thing that a lot of times we don't think about when we're exercising is the importance of um, the benefits for cardiovascular health. I mean, cardiovascular disease is still the number one killer for women. I mean, it is for men too, but we forget that for women, it's also the first, the number one killer for women. So yeah, so I like lifting heavy things, some weight training, resistance training, interval training, whether that's high intensity interval training or something of the like. But yeah, I think just move your body, whatever you can do.
Yeah, I've really, in my last probably 20 years of teaching exercise physiology, I have gravitated more and more to strength training
Hmm.
because, I've seen older adults that don't strength train, but they do, and we were trained years ago, cardio, cardio, cardio. That's
Yes,
what you did for
right.
heart health, but we
Yep.
neglected the muscles.
Hmm.
And there's so many other physiological disadvantages to not doing strength training. So how
I
does strength
completely
training
agree.
impact
Yeah.
things like bone health, metabolism, longevity, all
Mhm.
those things for everybody? But specifically, we're talking today menopausal women, and that's who we
Yeah.
want to reach today.
Well, and I think that so when women come to me with the symptoms of menopause, I say, wow, you know what would help? Building muscle, exercise, strength training. I mean, because what strength training does. I mean, so one of the big complaints about women at this stage is the weight gain and an inability to get it off. And so there's a lot of physiological things that are happening. There's insulin resistance going on, so higher insulin levels. We're holding on to more fat. So what strength training specifically can do, resistance training can do, is that it can shift that a little bit. It can increase our metabolism a little bit, which is great. So any change in metabolism is helpful. It also increases testosterone levels. So actually building muscle increases testosterone levels. So that decrease that women are having and that fatigue issue associated with it, and sometimes some mood issues. So that can go up, but also bone health. You mentioned bone health. Osteoporosis is a major issue for women, and so what that means is that basically it's development of brittle bones. And so you hear about women and men, with hip fractures and pathological fractures, in their extremities and their back and everything. And muscle resistance training actually increases bone mass. So you're protecting yourself from that too. So all of and it also improves our mood. So the moodiness, the fatigue, the sometimes also with low testosterone, low libido, all these things that start to bother women who are going through menopause. Like, wow, strength training can actually like check that box, check that box, check that box. So and also just again, strong is the new thing. We have to realize that this is our future, and we can make it a powerful, positive thing.
Would one of the side effects of menopause be a longer recovery time though? Because I remember when I was doing
Mm.
personal training, one of my certificates that I had to get, there was a whole study on the endocrine system. And through that, I learned that higher levels of estrogen was a recovery hormone and it helped
Mm-hmm.
recover the body. So if someone is going through menopause and resistance training is the way to go, but there's depleted levels of estrogen, does that affect the recovery time?
Yeah, yeah, it certainly can. I mean, I think you see that just with anybody with aging, right? Estrogen, I think probably, I don't know, studies show about testosterone too, but I imagine that has something to do with it too, just because, your lean body mass is decreasing, so it's harder to build muscle.
Right.
So yeah, no, I mean, I think it's a part of aging that recovery time can take longer. And that's the other thing. I mean, another aspect of moving your body that I also think is really important, especially for people that are getting older, are the sort of what I would consider the mindfulness exercise practices like yoga, tai chi, Pilates. And I think that by doing that and keeping your muscles and your joints and tendons and everything there, the flexibility piece is also really, really important. I think also that prevents, you guys would know better, just being in the realm, but it's just injury is also a big issue for aging people, and so it's easier to injure yourself, and it takes much longer to recover. So just sort of preparing your body to avoid injury and make your muscles and your tendons ready to recover is, I think, important, and some of those other practices can help.
What role does nutrition play in managing menopause symptoms and promoting long-term health?
Oh, okay. So first and foremost, I'm not a dietitian or nutrition expert at all, and so I mean it is big, especially especially with weight loss. if that's a goal for people, is to lose weight. I mean, we can't just muscle our way through weight loss, right? I mean, there's a huge there's not there, there's a significant focus on nutrition also that needs to happen. And so, yeah, I mean, I think that just really, what I usually encourage women to do who are interested in weight loss is to use is to track their food. I mean, this is probably something you guys recommend to people as well. Tracking their food, understand what macros are, protein, fat, carbohydrates, shifting that, shifting the percentages that you get during the day, especially if you're looking to build muscle. Making sure that the protein piece is a little bit higher. So, um, but yeah, it's unfortunately with menopause comes this weight gain, and so, and usually we don't, gain all the weight overnight. So losing that weight can take a little bit of time too. Is what I tell women. It's like, and that's why I don't like crash diets either, because when you lose weight really, really quick, it's going to have a tendency to just come right back. So kind of slow and steady is the way to go about it. So yeah, so I think nutrition is just an important part of so many parts of health, but especially during menopause when our body just feels like it is, I think I mentioned this is being hijacked by some sort of alien. It's like, what is going on with this? So getting back to basics, watching our sugar intake. I love recommending the Mediterranean diet. That's probably one of my favorite diets to recommend. But people who need to kind of dive a little bit deeper into that piece, I mean, we have great dietitians that we work with in the community who know a lot more than I do. But yeah, I try to get people curious about it, right? I mean, more as this, being open to ideas, being curious about it, and empowering them to go and find out and learn more.
Now I know you're not a nutritionist, but
Okay.
in theory, with an individual going through menopause with an increase of insulin and a decrease in the other hormones, wouldn't in theory wouldn't like a more of a low carb but higher fat diet, because the fat would help regulate the hormones, I assume, and then the lower carbs going to help monitor the insulin resistance as well. But again, I know you're not a nutritionist. I know you
Yeah,
can't. I
yeah.
just
So
in
I keep,
theory,
yeah. I mean, also, yeah, just really, yeah, making sure the carbohydrate intake is, and also looking at what you're taking in. So lowering sugar, I think, is really, really good. I mean, so I mean, I don't tell people to go low carb necessarily. I mean, just shifting those macros a little bit. But we want people eating whole grains, and because it's very important. But I hear what you're saying in terms of, because the rise in the insulin and the insulin resistance that happens. Yeah, I mean, you can, when you shift how you eat and those keto diets, I mean, you see burning fat significantly. But again, you also have to be careful not to lose it too quickly,
right?
because it's just like a lot of people can't maintain, that those types of diets. And but no, I mean, you're right. But exercise. I tell people too. It's like, but exercise can also do the same thing. Lowering
Totally.
the insulin, and so yeah, it's there's lots of ways to approach it.
Yeah, I think that Mediterranean diet is really one of the best, Mediterranean style,
Mhm.
because we've talked on previous podcasts about the Nordic diet as well as kind of rising as a kind of competitive diet, but they're essentially the same thing. It's just
Mhm.
how do you apply that to your more regional dietary
Correct.
availability, right?
Correct. I mean, it is, it's just, healthy fats,
Yeah.
limiting, sugar, and yeah, it's all the same kind of rinse and repeat type of approach. Yeah.
And it seems like the six pillars that we preach really
Mhm.
benefit women with going through menopause as well. The regular exercise, particularly strength training and physical
Yeah.
activity, maintaining a healthy body composition. And I think, you've mentioned weight quite a few times and the concerns for women. And I think,
Yeah.
I think one of the best things that we could do with younger women is to not let them step on a scale, because they have in their head that this number is good or bad,
Yeah.
and that's not the case, because every woman's body is different. And as we age, we will tend to put on some body weight. And maybe that body weight is muscle mass. So
Mhm.
who cares?
Yeah, so
And
who cares? Yeah, and and also, putting on weight as we age. I mean, you have to think that physiologically there is some evolutionary. there's some reasons why this is happening too. 'Cause someone's like, oh, this is just cruel. I'm like, it's cruel because we want to look how we did when we were 20, but do we have to? But also being a little bit heavier when we don't have as much estrogen, that it actually, our bones have to work harder and our muscles have to work. So we're actually helping support our bones by being a little bit, having weight than we did when we were in our 20s. So, and it's healthy at every size is, I think, the also what I'm trying to sort of move away from. It's just what's my BMI. What are numbers anyway. So I'm really trying to help everybody, not just women. Sort of just say, well, how do you feel in your body? Tell me how you feel. Do you feel healthy? Do you exercise? Do you feel that you eat right? Well, let's just work on the things that are going to make us feel healthy and just improve body image in general.
Yeah, I think BMI is one of the stupidest things we've ever come up with in science
Oh,
because if
oh,
anything, I want an older person's BMI to go up because they
yes,
do need a little bit more body fat. They should be gaining
I
muscle
agree.
mass. And you have
Hmm.
people, particularly women, well, my BMI hasn't changed. Well, yeah, but you've gone from being slender to being skinny fat, and that's not
Hmm.
healthy. Oh, but I
Hmm.
got a BMI
Yes,
under 20. It's like, well, you're not any healthier than your neighbor there that's been lifting weights and has a BMI of 25.
correct, correct.
So,
Yeah, yeah. No, so those numbers they don't tell the whole story,
right.
and they're misleading and also anxiety provoking for people.
Yeah. So get away from the numbers and just feel good, look good,
Hmm.
and, eat right, don't smoke, maintain that healthy body
Yeah,
composition. We'll probably
sleep,
talk a little bit more about
sleep,
sleep. Yeah. Sleep is that's our
sleep is
new
huge.
pillar.
Yeah,
And
yeah.
the more I explore sleep, the more I think that's probably even more important than exercise,
Hmm.
because you can be exercising, but if you're not getting to sleep, you're not recovering from it.
No, you
Right.
really aren't. I mean, that recovery time is so important for physical and mental health. Yeah, and that's what's difficult a lot of time for women. And this is again kind of going back to like who needs estrogen type of thing or who should be considered for estrogen. Women who have vasomotor symptoms that keep them up all night. I mean, that's not any good. I mean, so estrogen is probably one of the best treatments for that if a woman is, a candidate for it. There are other options too, but yeah, but then once you get your sleep back, everything else not at all, it's much easier for things to fall into alignment.
Yeah.
Hmm.
And what about women of color? What unique challenges do women of color face during menopause, and how do cultural and racial factors kind of influence the symptoms and more so the access to care that we see for women
Yeah.
of
I
color?
think that a lot of just being heard. Unfortunately, women of color aren't taken seriously or their symptoms are minimized. And so that piece of it is very challenging. And that's something that the healthcare community and society probably has to address. And so I think that, and access to care is also something that can be difficult. So a lot of it's kind of this kind of, the biopsychosocial access and approach to medicine is very skewed for women of color, unfortunately. So, but I mean, and there are, again, I'm not an expert on this, but there are physiological changes. I mean, one race, is not exactly the same as the other. I mean, we're all human, right? But there are different races are at higher risk for heart disease, kidney disease, and so sort of understanding that piece is also important in addressing the whole picture, what's going on and making decisions about what's the best way to treat an individual.
Yeah, I love that you said biopsychosocial. I've started in my classes. I have at every slide that I ever present in a class. I have at the bottom of it biomechanical psychosocial, because that's
Yeah,
something our biomechanists said. Oh wait, it's biomechanical psychosocial,
it's
because of the
interesting. Yeah.
movement piece of it as
Oh,
well.
I
But
love that. I'm gonna start
yeah,
using that. Can I use it? Can I?
absolutely.
I'll say Jeff told me it's okay,
Okay,
but
that works.
okay.
But I think that's important. And I think, a lot of times we tend to think of when we look at color, race, those types of things, that we're looking at the genetic piece of it. But the reality is we're probably looking a little bit more at cultural, sociological,
Mhm.
psychological pieces that are contributing to
100%.
some of those issues. So,
No, I completely agree. And we can't remove that piece at all. I mean, that is just as important as the biology, the DNA.
How is Generation X reshaping the conversation around menopause? And what positive changes are you seeing in the way society views women's health?
Yeah. Well, I mean, that's sort of me saying, used to being a proud Gen Xer, saying, "Oh, we're changing this." But I mean, if you even see, like I mentioned, that menopause is having a moment. I mean, you see it, people talking about it on the Today Show, and there's articles and everything. So I mean, it's definitely something. The curtain is being kind of pulled back a little bit. And I just had, yeah, I'd say that about Generation X is because the Gen Xers, the women in Gen Xers are we're the ones going through menopause right now. And, and it's just, we're like, no, we're not going to, this has to be something that's talked about. So I attribute Gen X for that piece of it. But, it could also just be, maybe just general, kind of evolution of medicine also, becoming more aware of this, of something that's been, overlooked for many, many years. So it's probably not just Generation X. I'm sure that there's some great millennials there, and boomers that are saying, "Hey, wait a second, this isn't right." But yeah, no, I'm really enjoying the more the fact that there's more conversations happening, and I think also the fact that hormones are being brought back as not something that's evil is something that's a great thing. Now, again, it's not that hormones aren't for everyone. However, but it's something that needs to be considered, and just to give an open, positive space to discuss it as an option.
I think the Gen Xers are really kind of pushing back because they're a little bit more informed and they're more that,
Mhm.
the internet generation. They
Yeah.
they have information available to them and they're pushing back. I'm at the tail end of the boomers and I tend to push back at my doctor. I can go off on, just some of the interactions I've had recently with my
Oh,
doctor and say, no,
interesting.
I'm not doing that. I'm going to do this. Like he's trying to
Yeah.
put me on statins for cholesterol. It's like, wait a minute. I know I need to lose some weight. My sleep has not been good. I have a sleep test scheduled for next week. Let's look at these things first before you ever put me on a statin that can
Yeah.
do more harm to my body than good. And so I think the
Potentially, yeah. Yeah.
Gen X they're pushing back, and I think that's going to help change medicine because, again, earlier the boomers, that generation were like, the doctor said to do this, I'll do it, whether I agree with it or
There
not.
you go. There you go. Yeah, it's sort of that, I hate to call it like paternalistic, but it's just sort of like, oh, well, this is, and it's not that you should, it's not like you should say, oh, my doctor, I know better than my doctor. Just, obviously, just, we all have our skill sets. We've all gone to
Yeah.
school for different things. So we bring lots of things to the table. But the way that I approach the conversation is, hey, you know what? This is my training. These are my recommendations, and this is why, right? Here's the data behind that, but ultimately, it's your body, and you get to make the final decision and how you manage it, right? And so, as long as you're informed, you decide what you do with your body.
Yeah, do the
So,
research, not just Dr. Google, but actually look at some of the
mm,
scientific studies
Dr.
that are
Google
cited.
makes his way into my to my office a lot. It's sort of fun. I'm like, oh, and that's why I'm glad I have extra time with my patients. I'm like, well, let's explore this.
So, speaking of kind of healthcare providers, how can they provide better support for women of diverse backgrounds in navigating menopause? What can your profession do better?
We can do a lot of things better. And I, and it's really hard because I think that it's not that we don't want to do things better, but I think that the environment for healthcare is not healthy itself. There's just, especially I can speak for primary care as a primary care doctor. I mean, there's a lot of our practices. I mean, there's so few of us in private practice. They're being bought up by hospitals. We're being told how many patients we have to see. This is how we have to make this many referrals to these doctors and everything. So I think honestly, if it's a broken system, and I think part of what can actually benefit patients, and especially patients of color or underrepresented, is actually fixing the system. And I'd really like to see that happen, to allow a platform where doctors can actually spend more time working with their patients and listening and providing a space. I mean, so much of it is just because it's such a hurried hurried visit. And like you were talking about the biomechanical psychosocial part of medicine, we are allowed to maybe look at the bio part of it, right? We're not allowed to look at the cultural issues, the social issues, and those play such a role. So allowing a system that would, first of all, support a platform for doing that is one thing. And then going all the way back to medical education, right? I mean, in medical school, really starting to introduce these topics early on, so that just becomes a normal part of how you practice. So, yeah.
And I think it needs to begin even before medical school. Um, I I'm biased being an exercise science professor.
Mhm.
I honestly think that all medical students should go through an exercise science program. And I don't know what your undergraduate
Oh,
basis was, but
yeah.
I see so many of the students that are going through programs like in chemistry and biology only get that bio piece and they don't get the psychosocial piece. They don't get the understanding that this is an individual. We need to spend time with them. And before we pull out the prescription pad, maybe we need to be pulling out the exercise prescription pad and doing
I
That's
some of those
right.
kind of
agree.
things.
Yeah. I agree. Okay, but and this is the other thing that I think that so when people come in, like they find, a personal trainer or they're an exercise coach, it's like they already are motivated to do so.
Right.
One of the hardest things in medicine is getting a person interested in buying in that this is something they can do because it's hard, right? I mean, it's just like just go exercise, but it's just there's so many different things that come in the way, but it because it involves behavior change too, right? And so
Right.
behavior change in medicine is one of the hardest things to prescribe. It's much easier to prescribe
Yeah.
a statin,
Right.
right? And doctors like to feel like we're successful. We like to feel like we're doing something, that we're healing patients. And so sometimes it's just easier to say, here, take this medicine to lower your cholesterol rather than, um, well, usually you'll prescribe both, right? But getting a person to change their behavior enough so that it's going to make a difference is a lot harder. So there's that piece too. I'm just going to throw that out there.
Right. And just access to the behavioral change. I mean, just because we tell
Mhm.
somebody to exercise doesn't mean, and they want to, they know they have to, but without a culture supporting it, a community that is designed about being
Mhm.
active or, being able to make time in the day to go to a gym or to do the exercise, that's a big piece of the behavioral change is that, we just simply are not providing access for people to be able to do that or
We're not making it
the
easy for
means.
them, right?
No.
We're making it quite hard, inconvenient to do that. And I agree that that's something that's unfortunate about kind of our culture, maybe. Yeah.
So what are
Yeah.
we mentioned earlier that women need to be aware of their symptoms, but I don't know if we
Mhm.
actually dove into that. So what are the most common symptoms for menopause and how
Yeah.
can women
Yeah.
effectively manage them?
Yeah. So, I mean, I think so. Some of the physiological things that happen just with the dropping estrogen, I mean, the hot flashes, what we call vasomotor symptoms. So basically, they can happen at any time, right? I mean, in the middle of the day, suddenly you just feel like you're on fire, start sweating. It's very disturbing. When that happens at night, it disrupts sleep. So that
Mhm.
can happen. But you don't even have to have another symptom of menopause is just poor sleep. And it doesn't necessarily even be the vasomotor symptoms. It's just really the sleep is just not good. You can't fall asleep. You can't stay asleep. Sometimes you're waking up earlier. And then there's the mood lability, the changes in mood, feeling irritable, feeling depressed, feeling anxious. That can also contribute to sleep too. So you can kind of see how they kind of layer upon one another. Um, Brain fog, brain fog, slower, I can't find my words, slower processing. Estrogen is really important in the brain. I mean, it's really important in all parts of our body, but for synapses and neurons to be working appropriately in women we've been using our estrogen all these years and to suddenly have it go away, that's hard. So you'll hear women talking about, they can't remember words or, they'll feel like just this sort of general brain fog. I have so many women coming to me and saying, I think I'm developing Alzheimer's. I think that it's dementia setting in, and it's scary, right? When you when your brain doesn't work as quickly as it did, attention deficit. So not being able to focus on things, it's kind of sort of the brain stuff. And other symptoms that can happen is, just general fatigue, decreased libido. So from a sexual health, you've also got just some of the physiological changes that occur in the genitals, like there's vaginal dryness that occurs, which makes relations, not much less comfortable, and so obviously you're not interested in that. Um, and then muscle aches and pains. So joint aches and pains, estrogen is also really important in maintaining flexibility and proper joint functioning. So there's all of that. I mean, that's not fun for all that to suddenly be like, hello, now it's time to deal
I
with all this.
Yeah.
Oh, and then you mentioned like how to treat it. Well, yeah, I mean, a lot of that it depends on the symptoms and the person and everything. But hormone replacement therapy is something to consider. Exercise. I mean, but usually it's a combination of all good nutrition. And there's other medications out there that can help. There are also non-hormonal um, medications out there now for women who can't take estrogen and they're having bad hot flashes. There are medications out there that can help with that. SSRIs, or which are things like Lexapro, or SNRIs, which are some like effects or can help with hot flashes and the movability. So there's lots of options. You just need to, bring that information to your doctor or healthcare provider, nurse practitioner, PA, and start a conversation about it. And also you don't have to feel this way. There are things that you can do. And I think just the empowerment piece is what's really important.
Do you have any strategies you recommend for kind of dealing with some of the sleep disturbances, the brain fog, the mood swings? And after you gave that list, I'm thinking, well, other than vaginal dryness, I think I have all those symptoms. I might be going through
Exactly, right?
menopause.
But it's the same thing because as I said before, dropping, and I keep mentioning estrogen, but testosterone, the dropping of the testosterone also causes these symptoms.
Right.
Probably not the vaginal dryness. I don't think
Yeah.
the vasomotor symptoms. I think we attribute that mostly to estrogen, but there's other things like the fatigue, the poor sleep, the loss of body of muscle mass, and that's directly related to testosterone, right? So, and so you said, I'm sorry, what was the question?
Just what are some of the kind of strategies that you might
Yeah.
recommend? Other, because we've talked a lot about treatments, but are there any other strategies that we
Oh,
can
for
use
sleep.
to for
Sleep. You
sleep?
were
And yeah,
specifically talking about sleep. Yeah. Oh, okay. So sleep, the elusive sleep. It's tricky. Yeah, I mean, sometimes just treating those other symptoms can help with sleep in general, but I think developing good sleep hygiene is really important too, right? I mean, the dreaded screens before bed, shutting those off about an hour before. It's interesting. I don't know what you recommend to people, but I usually tell people not to exercise right before bed. I think that can kind of yeah, I don't know if it's sort of just the hormones that are released. It makes it hard to kind of like shift into sleep mode. Um, so creating a dark environment. So there's kind of that sleep hygiene piece of it. Um, for people who still struggle with insomnia, and they say that they've made all the changes to their sleep hygiene. They're maybe even on if they're a woman, maybe they're on some estrogen or whatever, but they're still having problems. Cognitive behavior therapy for insomnia, CBTI. I don't know if that's anything you talked about before
no,
in
we haven't
your.
had that on the podcast yet. So
Oh, there we go. There we go. There's another. That's a great topic for you guys to start talking about. It
cool.
is extraordinarily helpful. And I know that you're like, oh God, therapy, but you know what? Don't. Yeah, it's the other thing we need to do. We need to change the stigma between getting treatment and support for our mental health. But it's just the cognitive behavior therapy for insomnia has been proven to be extraordinarily helpful to help people regulate their sleep, to understand why their sleep is disrupted and take control of it. Again, it's also just taking control piece of it. So yeah, I highly recommend it.
And I think being checked for sleep apnea is hugely important
Oh
as well.
yeah, 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 yeah. I mean, I'm just sort yeah, absolutely. That's I have an associate in my practice who does a lot of sleep medicine, and he's kind of our sleep guru, and so we do a lot of sleep studies in our practice. So that's the daytime fatigue, frequent waking. I mean, that's definitely something that needs to be evaluated and treated. So yeah,
Yeah.
sorry, I forgot to mention that, but that's huge.
Yeah. So I monitor kind of my sleep quality with the Garmin watch. And I know there's
Oh
other,
yeah.
Apple watches,
Yeah,
all those things can
it's
monitor.
interesting the data that we can get. I mean,
Yeah.
I have a Samsung.
Okay.
I'm an Android user. So I have a Samsung watch and yeah, it's really interesting. I started tracking my sleep maybe like a year ago. And it really is fascinating to sort of see that piece of it. I'm kind of a data nerd. So
Yeah.
it is neat to see that piece of it.
And I'm looking at all the things that I'm able to change that can improve that quality. And some of the best things I've seen,
Mhm.
obviously, is cutting alcohol out,
Oh,
having,
yeah.
and I think that's same for all individuals. Trying to have a little bit of chamomile tea in the evening. I've never been a
Mhm.
tea drinker, but I'm forcing myself. Okay, have a nice big cup of chamomile tea, shutting off
Mhm.
TV, electronics early. Reading has helped me a lot.
Mhm.
I've
Mhm.
also, we had John Newstad on it was earlier last year in season 3, and he's a more naturopathic doctor, and he has a
Yeah.
company, NBI, and they have a product called Sleep Relief that I just love. It has melatonin in it, but it
Okay.
also has some other time release products so that the melatonin kind of knocks you out, but the other stuff keeps you asleep. And that's helped me a lot. And then we had John Lewis on recently, who is a product. It's an interesting product, and I really like to study it a little bit more. But I've seen an immediate benefit in my sleep with taking his daily brain care, which is it's a polysaccharide that's derived from aloe and I think it's brown rice husks.
Oh,
And
interesting. Yeah.
and I was a little bit skeptical of it, but my sleep scores literally went up 30 points just taking that twice a day. And so,
Interesting. Yeah.
looking at the
Yeah.
things that we can take that are going to just give us that better sleep quality is going to have a huge effect on our hormones.
I think
Yeah.
it's also
No,
good to
yeah.
note that we are not sponsored by any of these. And so Dr. Armstrong's
Just
just
gonna jump in there.
preaching
Yeah.
it. Yeah, he's preaching it based off of his own own life experience,
Yeah.
and he's saying it because it works.
Yeah.
So, yeah,
Yeah.
there's no
No,
sponsorship on any of this. It's just
it's
yeah.
just like this is what works for me. No, it's great. And I actually, you know, health is so multifaceted and there's so many different people are trained in different ways and like I said I'm trained in traditional medicine but I work with naturopathic doctors and I love finding doctors that are willing to collaborate and because I say you know what and I tell my patients I'm like it's like this is the lens I was this is how I can give you recommendations this is how this is my skill set. However, it's not everything, right? And I think we also have to be curious about what other, providers have for us. So naturopathic medicine looks through a different lens and uses different supplements, and we have to respect their training. So yeah, no, I think it's great to just sort of find what works for you, and hopefully all of your providers can collaborate and work well together.
Yeah. It's always multifaceted.
How can women advocate for themselves when seeking medical care for menopause related concerns? Because you mentioned earlier how, a lot of doctors won't do the actual blood work. So what do women need to do to advocate for themselves?
So I think not necessarily, it's like checking blood work. A lot of times we feel like the only way that the doctor's doing something for me is if they run a test,
Right.
right? It's like that's it. So yeah, I mean, it's so in medicine, a lot of times we're really good at finding out what something isn't, but sometimes finding out the best way to treat something it can sometimes take a while. And if I kind of went off on a different tangent, you're asking sort of how people can advocate for themselves. I mean, I think that honestly, just developing a good relationship with your healthcare provider. And for women, if we're talking menopause, I mean, so that's your internist, your family medicine doctor, or, probably like a gynecologist. And, trying to find somebody who will take the time and give you the space to listen to your symptoms, right? And to validate where you're coming from instead of trying to minimize. And you also have to be careful of people who will try to either write you off or, hey, we're just going to test these things and this isn't what it is and see you later, goodbye type of thing. And so that's the other thing that happens in medicine. It's like, oh, you're tired. Let's check your thyroid. Oh, it's not your thyroid. Whatever, go on your way type of thing. I mean, it's really, you have to sort of find somebody and and keep looking. Unfortunately, if you have the opportunity to keep looking for somebody who will take the time and give you the space to discuss all of your concerns, and be willing just to be curious about the symptoms, and try different approaches, because not everybody's gonna respond the same way as everyone else. So yeah, speak up for yourself, be powerful,
Yeah.
be strong. Don't minimize what you're going through. I mean, a lot of times also as a women are just like they're embarrassed that they're going through these
Mm,
types of things, or they're just it's like, oh, or even from a mental health piece, I don't want to admit that I'm struggling with depression. I don't want to admit that I'm struggling with problems with my mood, and so that sometimes that's just a hard thing to sort of to grapple with. So don't be scared.
I think it's a challenge as well that we tend to promote what is normal and say, well, it's just normal for me to
Mm,
go through this. Well, yeah, it's normal because everybody goes through it, but what's optimal, and
yeah.
and what should I be doing to be the best that I can at this point in my life?
Yeah, I mean, we're all going to go through these changes. I mean, this is just our bodies are going to age, right? I mean, that's something that's going to happen to everybody. So it's just that there's going to be changes. But we can adjust or modify the suffering, I think, that we have, and so we don't have to suffer. Again, we're not going to look or even feel exactly how we did when we were younger, but if we can alleviate the suffering and just feel good about ourselves and feel that we have strong healthy bodies, I think we've done our job, and we're ahead of everybody.
Okay, now for the question that I ask of all our guests, and
Ooh, I don't know if I know
um,
this one.
I want to know what you're doing to personally age well. And I know strength training has got to be in
Oh,
there. So tell us a little
yeah, it
about what you're
is.
doing at the
It
gym.
is. So it's really interesting. I turned, like I said, I turned 50 last year, and you just kind of look at yourself. I've always been very active. I'm a tennis player. I go to Orange Theory, and so I did all these things. So I'm like, what can I do differently? Like, I want to do something that scares me a little. So I actually joined a climbing gym.
Oh, wow.
And I said, you know what? I want to climb. I want to rock climb. And so I started climbing, which is great. And that's actually, but you have to I was using muscles I had never used before, especially like upper shoulder muscles and everything. I'm like, I have to, better at this. So that's when I started working with a personal trainer. And I've worked with a personal trainer in the past, but I'm working with someone specifically. She's a climber. So that's how I'm doing. So I work out with her. I climb a couple times a week. I'm actually playing tennis when we get off this. So I don't know where are you guys again? I'm in Virginia, and so it's actually kind of a decent day here. So I'm playing outside.
Yeah, we're just outside of Portland, and it's actually a really nice day
Oh,
here. So it's,
great. Yeah, yeah. So you can get out and do some stuff. So there's that. I do yoga. So I do basically lots of different things, and I still actually do Orange Theory. I don't know if you. Again, I'm not paid by Orange Theory or anything, but I like it just because it's a good interval training program. There's lots of Orange Theory like issues, or programs out there. You got the heart rate monitor. You kind of reach a certain zone. I like it because it's high intensity, and then there's some recovery. So yeah, so that's what I do. But also I think with exercises, you have to do something that you love, right? And that's why it's sort of like, and that's why a lot of times people aren't necessarily like gym people. So if they're like, oh, I just hate going to the gym, I said, well, what do you like doing? Do you like playing kickball? Do you like playing tennis? Do you like playing pickleball? Do you like? And so I tell them to go and find something that they like recreationally that brings them joy, because you're more likely to do it. So you just have to find the thing that you want to do, right? So yeah,
what
that's me.
resources or communities would you recommend for women who want to stay informed and support during this stage of their lives?
Yeah. So there's so what resources? I mean, I know a lot of great resources for providers, healthcare providers that we go to. The NAMS, which is the National Association of Menopause Society. I think that's what it is. It's just basically so we can become menopause certified. So I think their organization has a lot of great resources for healthcare providers, but they also have resources for patients. So I think that for specifically for menopause, if and that's kind of the big kind of tilt that we were kind of leaning on a little bit today. So I think that can be really helpful. And yeah, I guess I'll just mention that.
probably wouldn't recommend just Googling menopause or
Please
going on
don't.
YouTube menopause and
Please,
just
you
following that
know,
information. Yeah.
no. I think, yeah. I mean, just so medical societies, menopause societies, those types of, the .orgs, the .edus. I tell
Yeah.
people to avoid a lot of the .coms for a lot of their information. But yeah, yeah.
Yeah, there's so many great resources out there when you think of like the Mayo Clinic, Johns Hopkins,
Mhm.
all these different organizations, even like, what is it? I can't think of the acronym for the obstetricians and
Oh,
gynecologists.
ACOG. Yeah,
Yeah. I mean,
yeah.
go to those organizations because that's where the information is. And when you get the information, go to the journal article that they talk about
Correct.
and read the article.
Yeah.
Because a lot of times, we get fed, so, well, science says this, but if you really look at the research,
Mhm.
maybe not, so you got to look at the
Yeah, yeah.
collective research.
You really do. I mean, just look at the Women's Health Initiative. I mean, that's something. I mean, and it was but I think we also just have to continue to be curious, to continue to look critically at any research that's coming out, right? And so, yeah, yeah,
Yeah.
good lessons.
Well, it sounds like you have a tennis game planned for this
I
morning. So,
do.
and
I
you're a little bit later
do.
in the day for us. So you probably need to be rolling. So
Yeah.
I don't want to keep up too much more of your time. This has been just an awesome conversation. This is kind of one of the conversations my wife has been on me for a while to cover some,
Oh,
menopause on this show a little
yeah.
bit.
Yep.
And
Mm-hmm.
so we're checking that box. So I'm sure she'll listen to it. And
Perfect.
we met when she was in Arlington.
Hey,
Yeah, she was
really?
in Arlington for, I forget how many years. I want to say it was like 13 years.
Oh my gosh.
Yeah.
She wasn't born here, was she?
No, she's from Long
Oh,
Island
okay.
originally
Got it.
and was
Mhm.
working down there. And the company she was working with was trying to get her to take a promotion in Michigan. And I was teaching at Eastern Michigan University. And it's a whole story of how, um, because my dad just happened to move down there, him and his wife, I forget what company she took a position for, but she kind of finished out her career down there. And so they were living in Arlington. And I was like, when she approached me on Match.com, it was kind of like, well, you never know. We might meet because my dad's down there, and I went down that August, and we went out like 4 nights of the 5 nights I was there, and
Oh,
that
so you
was
guys
it.
fell in love in Arlington.
Yeah, yeah.
That's
So
fantastic.
I forget
Yeah.
exactly,
Yeah.
which outside of which restaurant our first kiss was, but I
Oh my
should
gosh, there's
remember
a lot.
that.
Oh my gosh, there's
Yeah,
lots of memories for
yeah.
Arlington here. Yeah, no, it's a great city.
Oh yeah.
I've been here since, well, I moved to Northern Virginia in 2002
Okay.
to do my residency, but I'm actually Midwesterner.
Oh,
I
what part of the
was
Midwest?
Twin Cities,
Okay.
born and raised in Minneapolis, and then I went to college, did my undergrad at the University of Wisconsin-Madison,
Okay.
which is where I met my husband. And then I did medical school, medical college of Wisconsin in Milwaukee, and then I took the leap. A lot of Arlingtonians are sort of are transplants. There's not
Mm-hmm.
a whole lot of like born and raised in Arlington
Well, you get so many
people, but
government people and all that too
yeah,
that are coming
there's
in
it's
from
very
other areas.
transient. Yeah, yeah,
But talking about an area that is conducive to physical activity, it's a great
yeah.
area for that
No, it
because,
really is. I mean, also it's Portland, right?
mhm.
I mean, this
Well,
is like you.
Portland claims to be,
Oh, really?
but
No,
not to
that's not
be
real.
well, I mean, it talks about being so bike friendly,
Yeah.
and if you want to talk bike friendly, go to Arlington, the DC area, where you can
Yeah.
bike hundreds of miles
Oh my
without
gosh, my
running
husband
over.
is, yeah, no, he so we live in Arlington, he works in Rockville and he bikes.
Okay.
It's like an hour and a half. It's just yeah, it's far for people who aren't familiar with the DMV, but yeah, it's like, oh God, 20 some miles. So yeah.
Yeah. So, I mean, you can bike in the city of Portland, but we live south of Portland. And if I worked in Portland, I work much south. I work at Western Oregon University. So I definitely can't bike to work. But,
Okay.
if I wanted to bike into the city, it would be impossible. Or not
Uh,
impossible because we did have a neighbor that did it on occasion, but he put his life at risk doing it.
yeah. Yeah.
And so you really, if you want to say you are bike friendly, you got to have the bike paths, the running trails, the walking trails, and stuff like that are conducive to people getting outside and biking. Well, on that note, we're getting everybody to move to Arlington and move out of Portland.
Oh, it's fine, but we're happy to have you. It's a great little community. great schools.
Yeah. I think my wife would love to move back there, but I don't think we, necessarily could afford it, as the prices have
It's but
gone up.
that's the issue right now
Yeah.
with Arlington. But yeah,
Yeah. Moving from there to the Midwest and then out to Oregon, we were able to benefit from her having lived there. I mean, we both bought homes. I bought a home in Ypsilanti, Michigan. She had bought a condo in Arlington.
oh yeah.
And I think she doubled the price, and I made like 10 grand on my house in the same period
Exactly.
of time.
No, it's
Yeah.
No, okay.
So,
Cost of living here, unfortunately, is pretty high, but
yeah, but it's beautiful weather, and you get the mix of the weather, so that's kind of nice.
it's nice of weather. We still get the seasons, which is something that I really like. I mean, the summers in DC, I mean, it is a swamp, so it
Yeah.
is, a little hot and humid, but we're close to the mountains, we're close to the ocean and the shore, so it's it's
And we do have that
it's
here, where we're close to the, you can probably, you can go skiing today if you wanted to, or you can go to the shore.
It's amazing.
So there's a
Yeah,
lot to
I have
do.
a friend actually who's an OBGYN, or actually maternal fetal medicine doctor in Portland.
Okay.
So, yeah.
Well, we don't need that anymore.
Just, some people do. So
but I have students that are getting in that age. So,
yeah.
all right.
Yeah.
Well, we will let you go. Again, I just appreciate the conversation. This is very informative. I hope that the listeners and viewers will, really engage in it and allow this as an opportunity to speak to their doctors more about what they can do. And we just, thank you for what you're doing, the message you're getting out there, and just keep aging well.
Yeah. Yeah. Thank you so much. I really appreciate the opportunity.
You're welcome.
All right. Sure.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.